I am very pleased to be here this afternoon to introduce our moderator, Rich Besser. But before I do that, I just want to take a moment to thank the folks from the American camp who are doing the American Sign Language interpretation for us, not just today, but at all the programming that we're doing here at the Jerome Hotel. So actually, let's give them a round of applause. Terrific. So we thank you for being here. Let me take just a moment to introduce Rich. I'm sure many of you already know who he is. He's the Chief Health and Medical Editor at ABC News, where he provides medical analysis and commentary for all broadcasts and platforms at the network. He is especially appropriate to moderate this panel because he spent 13 years at the Centers for Disease Control and Prevention, and where he led the response to the H1N1 influenza outbreak and received the Surgeon General's Award. In addition to that, he's a very, very good friend of the Aspen Institute, so we're particularly delighted to have Rich here this afternoon. And with that, Rich will introduce our panelists and moderate for the next hour or so. Rich, thank you very much.
Thanks so much, Ruth. It's a real pleasure to be here this afternoon for this session to try and spark a conversation with two of the world's leading public health experts. I want to introduce them, and then I'm going to turn it over to them to share some of their initial thoughts. Tom Frieden is the director of the U.S. Centers for Disease Control and Prevention. He's been there since 2009, has worked to control health threats ranging from infectious diseases to battling leading causes of chronic disease. He was the New York City Health Commissioner from 2002 to 2009, and probably one of the most activist health commissioners this nation has ever seen. From 1992 to 96, he led New York City's tuberculosis control program. He helped build one in India, was there for 5 years, and worked to save 3 million lives. And he started at CDC in the Epidemic Intelligence Service. Dr. Wang is the Director General of the Chinese Center for Disease Control and Prevention. Since 2004, he's led a variety of efforts, including pandemic flu preparedness and response, swine streptococcus outbreak control, and ensuring public health safety during the 2008 Beijing Olympics. He was previously Deputy Director General of the Rural and Social Development Department in China's Ministry of Science and Technology and Deputy Director of the China Biomedical Engineering Development Center. From 1985 to 2000, he was a researcher at Peking Medical University. He was the director of its Institute of Hepatology and vice president of Peking University and Health Science Center. So we're going to be talking about a unique collaboration between two countries and what that means for global health. And so to start things off, just in a few minutes, I wanted each of you to talk about the history of that relationship, how it's evolved, how it started, and what the key components are now. And Tom, I'll ask you to start.
There's been a collaboration for more than 30 years. And initially, there were a variety of projects, and the most interesting one, perhaps, was on folate. And it was in China that the first real clinical trial was done to show that folate in pregnancy would prevent neural tube defects. And that project led to the strengthening of the evidence base, and that's why all of our flour is now fortified with folate, and we've cut the rate of birth defects, neural tube defects, in the U.S. in half because of that fortification.
So we learned that from the China experience.
We learned that from the China experience. So it was a terrific collaboration to build on. And we'd had long-standing collaboration in a variety of areas, but what really took it to a new level was the SARS episode of 2003. And following that, we've really expanded collaboration in many different areas. We have a program of global disease detection where we help train epidemiologists. And China has now trained, similar to the US Epidemic Intelligence Service, where we take 2-year service learning. Basically, we have a session on it tonight, but basically you throw a really smart doctor in and teach them how to find and stop an outbreak. Well, that's now graduated over 100 people who are working at many levels in China. We've worked on immunization. We've worked on HIV. We've worked on tuberculosis. And most recently, we've worked on non-communicable diseases. Dr. Wang, you and I first met 5 years ago. He came to CDC. There's a long-standing annual meeting between the China CDC director and the US CDC director. And it was his turn to come to the US, so we're having the meeting here tomorrow actually. But the first meeting 5 years ago, we decided that we needed to select flagship projects that we would focus on, and we selected 2. The first was expanding that field epidemiology training program, the EIS-like program, and they've been able to increase it somewhat since, so that they could have people who could base decisions on data. That's the bottom line challenge. And the second is to do something about non-communicable diseases, and we've got some very exciting collaborations on sodium reduction and beginning to look at blood pressure control. So that's a sense of the depth and breadth of the collaboration. But it is a terrific partnership, and we've been able to really learn a lot from each other and to get a lot more accomplished with each other.
Dr. Wang, from your perspective, what are the key elements of this collaboration, and historically, how did it start and how has it developed?
It's just that Tom is give the very brief, but key milestones is mentioned. This collaboration started 30 years ago. It's first the government to sign the bilateral cooperation is 1989. Just the second year, Chinese government to initiate this open and reforming policy. So at that time, China is increased the international cooperations. The first, the government, the agency is signed the agreement is through the China's Ministry of Science and Technology with US, the HHS. So after that, under this umbrella, the public health field, I believe, is the most active and close cooperation taken along with such years. So from emergency infectious disease, start from the SARS, then followed. So 2002, China CDC was established from several individual institutions. Then we signed agreement from 3 areas like the EID, the Emergency Infectious Disease Cooperation, and the Field Epidemiological Training Program. So such agreement is makes our cooperation more closer.
Dr. Wang, what do you feel some of the most important things are that you've learned from the collaboration, from the relationship with the US CDC?
Yeah, of course, from this is most important for China CDC. It started set up in the 2002. As we know, the SARS outbreak in 2003. Actually, it's originally started from the end of the 2002. This is the China CDC just the setup. So everything is not set down. So this is the suddenly has such stranger the disease, the pathogens. Everything is taken not like now. We already have some experience and capacity to deal with. So from that, we realized from a technique, from the understanding, from a knowledge, we need to learn more from outside of China. Of course, US CDC had so traditionally very experienced to deal with the infectious disease and compensities, global health, such experience and expertise. So that is just what we are eagerly wanted to have to build up our capacity. So we particularly to have such chance to learn from US CDC a lot.
And Tom, it's a two-way relationship.
It is, but just to mention, China CDC is called China CDC in China, even though that doesn't mean anything in Chinese. And outside of their buildings, which are big, beautiful buildings, are huge letters, China CDC. And, there may be other concerns about brand theft, but we're happy that they have the brand. And in fact, they've gone beyond that, and they've established provincial and municipal CDCs. So their health departments are called CDCs all over the country. I think one of the things that we've been able to learn more about is what's the most effective way to help another country collaborate with another country so that they develop the capacities that are needed to respond to whatever challenge they face. And in that, I think the field epidemiology training program is really important. This is a program that is...
Can you talk about that more broadly? What is the field epidemiology training program in the broad sense, and then in the China context?
So it's based on the US EIS, the Epidemic Intelligence Service. It's a 2-year program. You take someone who doesn't necessarily know anything about the area they're assigned to, and they become the world's expert over the next 2 years by doing outbreak investigations, figuring out how to track it, and getting intensively mentored. I went through EIS, and I remember the first major article I wrote up based on a very large outbreak that we had identified went through 32 drafts. And when my supervisor finally allowed me to send it to the journal, he said, and when you send me the reprint from the New England Journal of Medicine, I'm going to mark it up and send it back to you. So it's very intensively mentored, and that's why it has to grow slowly, because you have to build the local mentors who then train others. And it can be like a spotlight put on any aspect of health. So it can be influenza, where we have great collaboration. It can be injury. It can be sodium. It can be cardiovascular disease. It can be immunization, tuberculosis, HIV. So basically, it's disease detectives. But it's disease detectives not only for the traditional infectious diseases, but also for a wide variety of whatever the health threats a country faces are.
Dr. Wang, can you give me an example of where the field epidemiology training program has had value?
This is firstly is the concept to China, our colleagues to do that. This is came originally maybe from the education. We know that for the medical students, the clinical students, they are the education in the college. They are almost more than half the time they have to spend in the facility, the hospital, the teaching hospital. Then they learn step by step from a theories to the practice. But in China, maybe in most of the countries, the public health students, they spend all the time in the university campus. They have no such experience during their undergraduate course to do the practice. So it means just when they graduate, they have no any experience to deal with the population issue and the field issue. So that is why when we make some like in China province, Yunnan province, we have take the 20 years, we call it the sudden death. Is the family members suddenly die. Then the family other members to prepare with these bodies, then died again. Such very strange death is confused that efforts for the 20 years. But no people to do the detectors to make from the field, from this site, this food, water, environment, or some wild plant to eat, mushroom, something. All the things we don't know. So when they have the field epidemiological study, they do the very carefully, systemically, with the support and the leadership from US CDC's, we call it the advisor, Robert Fountain. Go there, take the students work together to carefully to study everything, the trees. Then to give the majority is the cause. It's a stranger mushroom, very small one. They cause the people the heart disease.
So the investigation by the field epidemiology training program was able to identify this mushroom that was causing this problem for 20 years?
Yes, yes. So without such concepts, the people do not know how to deal with it. We send the clinical doctor, they only to see the patient, the individual. Then we send epidemiological, the people, public health people, they cannot to integrate all the knowledge of that.
Yeah.
I think what Dr. Wang Yu is saying is really what we find all over the world, including in the US, that you have a clinical world and you have public health schools, but neither of them have the kind of practical epidemiologic experience to do an outbreak investigation and control, or the kind of practical intervention programs. And that's what EIS is about. We actually have a couple of EIS officers here for the session tonight, but I like to think of it, some people call it consequential epidemiology. I like to think of it as interventional epidemiology.
So is China the only place where there's one of these field epidemiology programs?
No, we have 40 of them.
40?
40, all around the world. China's is large. Needs to get larger, but it's large. But for example, we now have a large program in Nigeria, and that program ended up being the nidus of a very effective program to help us make progress on polio eradication.
You know, one of the things that strikes me about the collaboration between the U.S. and China around public health is that you both work within a much bigger political context. And our countries, in some arenas, are quite competitive. This is one where it's quite collaborative. Can you talk a little bit about some of the challenges of being technical experts working within a political framework?
Yeah. Up to now, the Chinese government gave the 3 U.S. CDC's experts in China with the top reward for National Friendship Award.
Top awards?
Yeah, top award.
The top award of the government of China given to 3 CDC staff.
CDC, Barbara Fountain and Robert Barry, and second is former director Jeff Copeland. So they own this award for that. It means the Chinese government and of course the public health colleagues in China, they are thinking we have the great support from US CDC experts during such years. So I don't think we need so much the interrupt from the political issue.
There are a few different aspects of that question.
Yeah.
One is our partnership, and I've never experienced problems with our partnership. It's very open. If you look at H7N9, after SARS, we helped China to establish surveillance for influenza, to learn how to sequence the genome, to become one of the only 5 in the world WHO collaborating centers for influenza, to establish a surveillance system for it, a monitoring system. And when H7N9 hit...
What is H7N9?
I'm sorry, avian influenza, the new bird flu that hit China 2 years ago with a very high death rate among people who were infected. When it hit, they were able to find it quickly, to sequence the genome. So the whole genome was available to upload that sequence on a global sharing platform. We were able to download it, make a diagnostic test within days, and begin working on a vaccine within days. So there's a tremendous harvest of that collaboration. And you know, it reminds me of smallpox eradication. In smallpox eradication, that happened during the Cold War, and yet the US and the Soviet Union were able to collaborate on that project specifically. So there is a health aspect that transcends politics. At the same time, I think each of us within our own countries, and I think this is the second aspect of your question, deal with political issues that aren't easy.
Yeah.
They can be straightforward as vaccine policy, or they can be pretty complicated in terms of some of the non-communicable disease policy and control measures. We always try to bring data to bear on it and hope that when people see the data on what's really happening and what really works to prevent illness and death, they'll follow that path.
I want to dive into this aspect a little more in terms of the issue of transparency, because we've talked about that here, we talked about that some this morning, and the importance of that in terms of a health response. There are times when the political organization in which public health works is less keen on that transparency in terms of sharing information very quickly. And I wanted to see if you could each speak from your own perspective on some of those challenges of how do you convince the political leadership of what you truly see is the value of being very open with health problems that may have consequences way beyond health.
Well, to give you an example, Rich, you worked so wonderfully on H1N1. When I came in as CDC director, it rapidly became clear that the vaccine was not going to come in time. And in a congressional hearing, When asked, I violated the first rule of congressional hearings, which is say nothing quotable. And I said, no, actually, in all likelihood, the fall flu wave of H1N1, the avian influenza, the flu pandemic, swine flu or avian flu pandemic that occurred in 2009, in all likelihood, the fall wave will peak and begin to fall before there is sufficient vaccine. And I will tell you, there were many in Washington who were furious at me for saying that. But you have to level with the public. CDC, the US CDC, is the most trusted agency in the US government. In poll after poll, by Pew, by Gallup, by others. And we are that way because we tell it like it is.
But you can take a hit sometimes for that transparency.
You can.
Yeah. What about in China? Are there issues as well that you face in terms of being transparent? I mean, there was such a dramatic difference with how information was shared around H7N9, the bird flu strain a couple years ago, and the way SARS was handled in 2003. What's led to that openness?
I think right now we are just, of course, just after the H7N9, the outbreak, the people, the globally to know these issues, then many articles, many comments to comment these issues, the Chinese government and the experts release the exact, definite, in-time search information compared with the SARS. But I think this is only the step by step, not the exchange only the one day, overnight, all the situation is changed. It's practice, the training the government, training the public, training the professional people, one step by step. Then from a small, from a very limited the event, then give the government and public. They learned the transparency is we can get the great benefit from such transparency. Particularly in the global right now, the information techniques is so global, this we are widely used. You cannot keep some information is very secret. So such conditions ask us give the correct, clear, definite information immediately to the public.
You know, the relationship we've been talking about so far is a bilateral relationship. I was wondering whether there are situations where China and the United States have worked together in another country to provide assistance.
Yeah, we're beginning to try this, and this is one of the things that we've talked about a few times. The very first thing that we did together, Dr. Wang, you said they want to do more in global health, and they've been asked to do more in global health. So there's a program called Stop Transmission of Polio, and we send people in for 3 to 6 months to work on polio eradication. And we thought jointly that it would be a good experience for some of the China CDC staff to have this, see what it is to work in global health. They went to Pakistan. They had a very challenging experience there, got really very eye-opening on the challenges of global health and insecurity. So that was the first, and we're exploring other possibilities of what we can do together.
Can you share a little bit about the Pakistan experience?
It's very I think, helpful and interesting, just because we, through our contact with the US CDC experts, we learned almost every expert come to China from US CDC, they had experience, worked several years in developing countries, in Africa, in Asia, everywhere. But at that time, in China CDC, no anyone had such experience to work outside of China. So that's why we had original ideas to learn our colleagues in US CDC. How do we have under the global health? If no people to have such experience, including myself, is cannot match the global health concept. So this is one. Another one is under the STOP, this project, the polio eradication. So how in China, CDC, the experts, and also include our prevention CDC colleagues, we organized then first under the WHO the umbrella this project through the US CDC to go to the Nigeria, Ethiopia, then finally go to the Pakistan. We sent 10 people, 3 months worked first time to Pakistan to work on the polio eradication. But before our experts go abroad to take the 2 weeks the training in US CDC Atlanta.
They go to the
Atlanta first, not only for the technique how to, but also for the security issues, on how to keep yourself safety, where you live in the hotel, maybe much safe the position, something like this. So our experts got the well trained and experienced through such activity.
You know, Dr. Wang, you said something very interesting that I had not actually picked up on until just now, which is that they were observing the Americans coming in and noticing that they had all had experience in global health, and that this made them better public health experts. And I often rattle off a half a dozen reasons why the US should invest in global health, but that's a 7th, actually, that it makes us stronger, it makes us better at what we do. And certainly, I can say in my own career, it's been very important. The 5 years I spent in India were formative for me in helping me figure out how to get something done in public health.
In what way?
Well, first it was working against pretty high odds. So you have to be willing to say, you know, we're going to throw everything at it and do our best, even if we know it might not succeed. Second, you have to think of lots of ways to go around a problem if you can't go through it. You know, Americans are very straightforward. I had a pivotal moment in India where there was a key thing we had to do, and there was a key person who could approve it, and I went to meet with him, and I gave him all the reasons why it had to be approved, and he said, Dr. Frieden, you should understand that there are some problems for which there are no solutions. And I thought, Americans don't believe that. And eventually we were able to get that thing approved, and that made all of the difference in advancing the program. But just in the broadening your horizon and the playing field of how to get something done.
Yeah. I want to shift topics here, and we've been talking a lot about infectious diseases. But clearly, one of the areas of health that is most concerning in the United States and in China is the area of chronic diseases. And what is being done within this collaboration to advance work around chronic diseases?
So we had a discussion of this 5 years ago and decided to deal with blood pressure, starting with sodium reduction. And China decided to do a very small pilot project, very small.
Why blood pressure? What's the big deal?
Blood pressure actually is the only thing that kills more people than tobacco in the world. 9 million people around the world, and a particularly big burden in China, where their stroke rate is 5 or 10 times what ours is. It's the leading cause of death in China, stroke. For us, it's 3 or 4. So we know that blood pressure, basically we could do 2 things. One is reduce the number of people who have high blood pressure. The second is increase the number of people who are effectively treated for high blood pressure. And you can reduce the number of people who have it primarily by reducing sodium in our food. About 80% of our food, sodium, comes from restaurant and packaged foods, but there weren't good studies on where it came from in China. So they decided to do a very small pilot project in a little province called Shandong. It has 100 million people in it.
Definition small.
So this is a pilot project that's 10 times the size of many countries we work in at CDC. And it's been a very, very interesting project. We're just getting some of the initial results, but the concept is very important. First, figure out the sources of sodium. And it turns out theirs were completely different from ours.
What are the main sources of sodium in the Chinese diet?
Yeah, we chose the Shandong province. They have some reasons. First, as Tom Frieden this is just its size is 100 million, one provincial. So this is suitable for do that because up to now the people only to know from technically know the sodium to cause the hypertension, but know the large scale of the result, the evidence to support really the decrease the sodium, we can decrease the hypertension, then finally decrease the stroke. So this is why we wanted to do the pilot study in search prevention. This is one. Second one is I just wanted to mention to you, if you visit in China, be careful. Shandong food is much salty, traditionally. So if already it's very low, the food is very difficult to see it. So Shandong food is very salty, traditionally. So this is why they had very high the stroke incidence and heart disease.
Yeah.
So such the reason make us to choose the Shandong province. Last one is Shandong the people. They have very strong the implementation the capacity to do that. The government to want to do some things, they can very unique. They can organize the people in Shandong province. If you choose the one province very soft, it's very difficult to work with the government. So it means you cannot to get the success. Shandong province, because the government to organize all the sectors, from industrial, salt industrial, to restaurant, to education, the school, and the community. Everywhere, every population, you have to give the common effort to do that. Then we can make the salt reduction. The Tom Frieden will also to go to together to go to site visit to Shandong, to go to the one countryside, one small town. We visit the restaurant, go to the community, go to school. You can see everywhere. You can search the education to the people. Restaurant, the owner to show us they are not the advertised to say for your healthy, we added a little salt in your food. But if you like, you can put another extra salt. So such education is advertised to make the population to know. Just we got this recent, only the middle with evaluations from daily 13 grams. The WHO recommended
13 grams.
13 grams. WHO recommended the 6 or more less, 5 grams per day. The Shandong food had 13 grams. Now maybe some areas 1 gram is decreased.
1 gram.
So it's coming down.
It's come down.
You know, one of the hardest things to do is to change behavior. So has this resulted from people changing what they do, or changes in terms of how manufactured food is produced?
Yeah, it's Shandong government also. At that time, they signed an agreement with the Ministry of Health to do the salt reduction. So they asked the many different sectors to follow such instruction, negotiate with the salt industry.
Yeah.
Shandong province is half is has sea coastline. They are the bigger province to produce the salt. So they supply the whole country with the salt. You ask them to how to make the food, is decrease the salt. It's hard negotiation.
I think we found that the main sources were first raw salt added in the kitchen. And they often weren't measuring spoons. So one of the simple interventions was providing measuring spoons and saying, you shouldn't have more than this much salt in the whole day. A second was soy sauce, and a third was pickles, pickled food, which is made with high salt content. Yeah. So it was, first you look at the data, then you see how you can change that. And I will just mention, before we leave the issue of high blood pressure, that if you were looking for an area to invest in globally where you could see the biggest return on your investment in terms of lives saved, it would be blood pressure control globally. Because we do a terrible job at it. These are inexpensive, highly effective drugs, and we have only about 15%, 15% global control of high blood pressure. And yet it causes so many strokes and heart attacks, and a lot could be done in this area.
I'm going to open it up in a couple minutes to the audience, so if you be thinking about your questions, we'll be passing a microphone around. One of the issues that I know, Tom, you're very concerned about is antibiotic resistance, and the possibility that we could approach a post-antibiotic era. Is this an area where there is collaboration between the two countries, and how do you approach a problem of this magnitude?
So two issues. One is laboratory and surveillance. So the first part of dealing with a problem is understanding it. Where is it? Where is it more severe? What's the cause of it? What are the ways to reduce it? So we've had many laboratory collaborations so that the China CDC can have the laboratory infrastructure to test for drug resistance and the surveillance infrastructure to monitor for it. And we have that, of course, for Tamiflu resistance in influenza. But an area which I know Dr. Wang is very concerned about is tuberculosis. And I worked in tuberculosis control for more than a decade in India and in the US. Multi-drug resistant tuberculosis is a real threat to our ability to stop the epidemic, but we really can turn it around.
Dr. Wang, why is drug resistance such a problem for tuberculosis, and what are you seeing in China?
In China, each year we had 1.3 million new tuberculosis cases.
1.3 million new cases.
So among them, we have the 100,000 multi-drug resistance tuberculosis. So how to find them?
Yeah.
Now, only around the years, several thousands drug resistance patients was found and received regular treatment. So this is the big problem and challenges in China. First reason is because the antibiotic, anti-TB, the drug is too old. No new medicine to give. Very easy to reduce to cause the drug resistance. From our first the patient, among them, already 8% of the patient has the drug resistance, the strain. So how to find them to give their regular treatment is the challenge. This is why we worked with the US CDC experts, use the new technology to quickly to find the resistance strains patient, then give them the regular treatment.
So there's laboratory collaboration on this?
Yeah.
There is, and I think the next big area of collaboration has to do with infection control in hospitals, because what we've learned is that a lot of drug resistance spreads in hospitals. And in fact, when I was an EIS officer in New York City, we were able to document that a very large proportion, probably most of the multi-drug resistant tuberculosis in New York City when we had a very large outbreak was drug resistance that had been picked up in the hospital. So if you, on the one hand, that's bad news. You don't want hospitals making people sick. On the other hand, that's an opportunity for leverage because you can go into the hospitals and improve infection control and turn off the tap of the creation of new cases of drug resistance.
I want to open it up to those of you in the audience if there are questions. If not, I have a slew more. So there's a microphone. If you put up your hand, she'll come around with that. Down here in the front. And if you could say who you are and who you're with, if you're with an organization.
Over Shands Hospital, Gainesville, Florida. Would both of you comment on what you see as the effect of climate change?
Do you control the mic back there, or
And epidemic?
it's not on?
So
There, now it's on. Now it's good.
So Bob Thoburn, Shands Hospital, Gainesville, Florida. Would both of you comment on what you see as the influence of climate change on epidemics in different parts of the globe?
Yeah.
So climate change obviously is going to change, for example, where vectors are, mosquitoes and other vectors, in ways that aren't always predictable. It may increase in some areas and decrease in other areas. But one thing it does require us to do from a public health standpoint, as public health professionals, is increase resilience, increase our ability to track problems and respond effectively, increase our ability to deal with extreme weather events, heat, floods, and other things. And all of that is really not so far apart from what has been done in CDC China post-SARS with establishing a system to respond to emergencies.
Dr. Wang, comment on climate change and health?
Right now, we are most concerned about some disease emergency, the new diseases with the climate change is dengue fever.
Dengue fever?
Dengue fever. It's transmitted by the mosquitoes for that. So a few years ago, almost no cases reported in China. If one imported to China, has a leadership epidemic, very sooner we can eliminate it. But now, the more cases come imported cases in the south of China. It's much the cases is accumulated much more than before.
Question back here.
I think both in China and the
could
US.
you introduce yourself?
Uwe Reinhardt, Princeton University.
Thank you.
In both cases, CDC is constrained by budgets, of course, as it should be. But, and probably they're too tight.
I don't know that it should be that way.
Well, it happened, Genesis 3, read it, the fall from grace, when Adam and Eve got kicked out of paradise. That's when budgets started. So, but if you, both in China and in the US, had an increase of, say, 10% in your budget, what is it you would do that you think should be done that we're not now doing?
Tom, do you want to start on that?
So I would divide things into US and global. In the US, we would definitely scale up our response to antimicrobial resistance because there's much more we can do there. We would scale up our response to the epidemic of prescription opiate overdose, which is killing more people than heroin and cocaine combined. And we would scale up our work on tobacco and other means to reduce heart disease and stroke because they work. We run an ad campaign for 3 or 4 months a year, and we save tens of thousands of lives with that campaign. And the payoff for the healthcare system alone is probably 20 to 1. But we have to stop running it after 3 or 4 months, and then the field is clear for the tobacco industry for the rest of the year because we have as much money as they spend in 3 days. On the global front, we would really strengthen our work on global health security. So we have many, many more countries with strong national institutions that can find, stop, and prevent health threats. That will help them, that will increase global stability, that will increase global economy, that will protect us, but we're really constrained by the budget. So those are some of the things that we do, and if you have the $1 billion for us, we'll spend it well and quickly.
Dr. Wang, if you receive 10% more budget, what would you focus on?
Yeah, this is in China because it's quite a different system with the US. And we have the 4 levels of CDC. National level of the China CDC, then go to the provincial level, we have the 31 CDC. Then go to the city. Final, go to the county level. We have 3,000 county CDC. So after SARS, of course, we built the new buildings for all of our CDC's workplace for that. But still, the workforces and the people, the training, the technique facilities is much is lower for our demand. So China CDC right now is developed quickly, but still the provincial and the county level people, they need the training facilities for the new. So such things is our urgent to do that.
I want to take the moderator's prerogative and throw in another question related to tobacco, because when we're talking about chronic disease, tobacco is incredibly important. Both the U.S. and China are major producers and exporters of cigarettes. What role do your agencies have in trying to impact on that and looking at not just getting people to stop smoking, but making cigarettes less available here and around the world?
Well, in tobacco control, as in the areas I mentioned, public health really is a best buy. We have a great payoff, not only in terms of lives saved, but in terms of money saved for the healthcare system and society as a whole. CDC has a series of things we do in tobacco control, US CDC. One is that we run the Tips from Former Smokers campaign. That's the first national anti-smoking campaign. It's been a tremendous success. It's helped hundreds of thousands of smokers quit for good. Second, we fund state and local governments, and I think that's what Wang Yu was talking about, the need to fund more at the state and local level. So we help state and local entities establish comprehensive tobacco control programs. In New York City, we were able to cut adult smoking by 1/4 and teen smoking by 1/2 in just 8 years. So local action can make a really big difference. And we also have a very important role in the laboratory. CDC has the most sophisticated tobacco lab outside of the tobacco industry. So we are able to document and monitor what the tobacco industry is doing to products, and that may ultimately allow us to support the Food and Drug Administration in their effort to regulate tobacco.
Dr. Wang, how much concern is there in China about the use of tobacco? Is it viewed as a major public health issue?
Because the tobacco is the top reasons for preventable disease, the cause of that. So if we were talking about to change the behavior, to make the more healthy and live more longer, first thing is to quit tobacco, smoking. So this is why we want to put our NCD's top priority for tobacco control. But the problem is right now, tobacco industrials from agriculture to the industrial for that is still mixed with the China's economic. The local government still rely on the tobacco, the taxes, the money to running their business. This is why if we talk first should be make the government to take such responsibility. It's not only to looking for the economic, but also to looking for the people's health, to thinking the tobacco, the industrial and the youth. That is why.
I haven't looked over here. Any questions over here? I'm always blind to my left side. There we go. Okay. Thank you.
Hi, Quentin Chu, Crestwood Partners from New York. To Dr. Wang's last point, have you tracked what the impact on environmental pollution on public health, and does the China CDC have any impact on curbing pollution?
It's very hard to answer your question for that. Of course, the air pollution now is caused already is put the government. The level of government top priority for that, particularly in the big city, in Beijing area for that. But just because this is through the such years, the industrials developed, it caused such serious pollution in some areas, not only for the air pollution, but also for the water polluted by the industrial for that. But for our public health side, now the first issue is want to address what's the impact to the health. Only the people that worry about that, but what's really the impact for the health? Air pollution, it has a very negative impact to the health, but compared with the smoke, whether or not it's important. We are worrying right now, if the government put all the money to deal with the air pollution, but they were more neglected for tobacco control. The public thinking, oh, my disease, my lung cancer is caused only because of air pollution, but they don't think about the tobacco control is the most important for that. So we should balance all the issues, risk factors for the health.
Is environmental health one of the areas where you envision more collaboration going forward?
We can certainly explore that. I think the issues are challenging, and the PM 2.5 issue is very major.
PM?
A particulate matter 2.5, basically soot. And the more soot there is in the air, the more heart attacks people have, and the more early death there is, the more asthma there is. So one of the things that we could provide assistance to is documenting the health impacts of air pollution. But sometimes that's not as easy and straightforward as the infectious disease epidemiology, but very important for China, for us, and for all countries.
Questions in the audience? Here in the middle?
Alan Dow, Virginia Commonwealth in Richmond. One of the long-running tensions in public health in this country has been sort of the boundaries of what public health can intervene on. And I'm curious if you guys ever sort of commiserate because he's able to do stuff that you can't and vice versa, and thinking about what you can tackle.
The US CDC, because we've been around for more than 60 years, because we fund state and local health departments, because we have a high credibility within the U.S. government and the public, we have a lot of ability to influence policy and influence perceptions of issues. At the same time, the 10% increase in budget that UE has promised me has not come through yet. And I think this is our major constraint, that public health tends to be the poor stepsister. Public health is the best buy. It can drive down healthcare costs. Look at healthcare costs in the US. 65% of Medicare costs in this country are from 5 diseases which are largely preventable through public health action. So it's so frustrating that here we have the tools and yet we're smaller than a rounding error when it comes to the cost of healthcare. So I think both of us struggle with how can we synergize really with the healthcare system, because we can deliver so much value by improving health and reducing the need for treatment. We've made some progress in recent years in the US after passage of the Affordable Care Act with the Center for Medicare and Medicaid Services, CMS, which is implementing it. Suddenly, I think both CDC and CMS understand that there are values to collaborating. And so we've built bridges that never existed before, whether it's on healthcare-associated infections or community action to reduce chronic disease. So I think we both share that frustration of how can we most effectively improve health and healthcare.
Before we wrap, there's a question I need to ask you, Tom. I mean, there are so many domestic health problems that we face here, and you're talking about a limited budget. How can you justify spending some of that limited budget on relationships like this?
Well, I've been asked that, particularly with respect to China, by members of Congress. And we make clear that our partnership with China is a partnership of technical collaboration. So if there's a program that needs to be run, they do it. All of their immunization, all of their surveillance, all of their staff salaries, all of their laboratory building, that's all funded by the government of China. But the technical collaboration benefits them, benefits us. Globally, there are so many reasons to collaborate because, for example, we'll be safer. If they find H7N9, that new influenza, earlier, we're safer. Because in a country like Haiti or Africa, if they don't have an outbreak, they'll be more stable and we will be less likely to have to intervene. Because countries around the world will be more economically vibrant. And that helps everyone and lifts all boats. For the US, it also is a form of diplomacy, that we're making clear that we're part of the solution. And the work we do in Africa and Asia and Latin America brings us tremendous goodwill for the US in the kind of studies like the folate study we started with, where we can learn things quicker, cheaper, faster, better sometimes in other countries than we can learn them here, because there may be more disease there or more people who can be studied. But fundamentally, the reason to do global health is because it's the right thing to do. Because we're a great country, because we care most about saving lives, and because this is how we can save the most lives.
Dr. Wang, and a last question for you. As you look at the relationship going forward, and if you were to think about the next 5 years, what change would you like to see in the relationship to make it more effective?
We have the two sides issues. One is inside China. We want to increase our capacity building through our practice, like the Shandong province, the salt reduction, and other like the tobacco control. Such work we can get the support from US CDC. You know, the salt reduction actually is most technically is a very complex issue for that. It's to judge whether or not how much the salt the people take, then where to go down. This is the issues. We should have the most close cooperation. Another issue is just we mentioned is under the global health issues. How to China CDC with the US CDC to work together to go to the third or other place to work together to involve to deal with the global health issues.
Well, I want to thank both of you for a very stimulating hour, and I've learned a lot about the relationship, and thank you all for your attention and your questions.